Hi, I'm Salim, and I'm going to talk briefly about how development policies and development projects that reduce air pollution have a range of direct health benefits as well as indirect and wider societal co-benefits that also positively affect community health and well-being. I want to start with the example of policies and projects that promote sustainable modes of transport through, for example, improving and increasing the use of bus and train networks, and supporting people to walk and cycle more by building foot and cycle paths, what's called active travel, and developing and increasing the use of ride-sharing schemes for private cars. Firstly, sustainable transport reduces air pollution with direct improvements in heart and lung health for children, the elderly, as well as adults in general. It reduces the development of cardiovascular and respiratory illnesses in healthy people and reduces the severity of symptoms in those who already have some kind of long-term cardiovascular or respiratory disease. Air pollution also has effects on children's cognitive development. Secondly, sustainable transport increases the likelihood of people engaging in physical activity. Even the short walks going to and from bus stops and train stations can lead to measurable improvements in physical health through increased physical fitness and mental health and well-being through a reduction in stress, as well as helping to prevent weight gain and potentially, over the longer term, obesity, which is an increasingly important issue worldwide in low, middle, as well as high-income countries. Thirdly, sustainable transport improves accessibility to goods and services and social connections that also have physical and mental health co-benefits through better access to family and friends, health centres and medicines, community centres and social care services, educational institutions and educational opportunities, and household appliances and daily necessities. This improved physical and mental health and well-being can also bring wider economic benefits through reducing workplace absenteeism and increasing occupational productivity. In a similar way, policies and projects that promote sustainable energy, such as those that shift energy generation from fossil fuels to renewables, that increase household and industrial energy efficiency, and that support the use of hybrid, low-emission or electric vehicles and equipment, also have direct, indirect and wider community health benefits. Firstly, sustainable energy reduces air pollution, resulting in the same health benefits described for sustainable transport. Secondly, sustainable energy contributes significantly to the reduction in greenhouse gas emissions, more so than sustainable transport, thereby helping to mitigate the global health impacts of climate change. This is important because climate change affects community health and well-being through raising average global temperatures, increasing the potential for heat waves and heat-related death and illness, putting at risk the availability and quality of the food we eat and the water we drink, increasing the likelihood of extreme weather events such as flash floods and droughts, and increasing the geographical spread of communicable diseases such as malaria and dengue. Lastly, it is important to bear in mind that reducing air pollution also improves plant and animal health, as well as human health. Therefore, reducing air pollution improves and enhances global biodiversity and increases the resilience of global ecosystems, both of which are important for human health and well-being.